I had a 25-year-old female come in with a presentation of a psychiatric illness. Comes in, very flighty, pupils were pinpoint, she was very scattered in thought. She had what we call word salad, which is she's not speaking in coherent sentences. I was alone in a room off to the side, room 13 actually we call it, which is our psych room at the time. She left my room and entered into the patient bathroom of the psych area unsupervised. At this time, we could not determine if she was a threat to herself or others. Now she was unsupervised behind a door. I was able to get through the door, in which point she had stripped off all her clothing and was throwing water at me. At this point, for many reasons, I called for immediate backup, especially a female attendant, because I was left alone with another person who happened to be my patient and stark naked. This patient comes in Spanish speaking only, which is a deficit to us because not everybody in our facility speaks Spanish, with abdominal pain. And at that point, I decided that we should stop and have a physician see this patient prior to going upstairs to the labor and delivery unit. Unfortunately, we couldn't get much information on this woman at the time because we were unable to acquire a translator, so I sent the patient to room 10 to have a physician just do a quick eyeball of her. I continued about my business, and I guess prior to the patient going into room 10, she stopped and asked to use the restroom. She got up off the stretcher because the ambulance staff let her, at which point I heard a huge commotion, crying, screaming, things flying everywhere. I come around the corner to find one of my nurses in the bathroom with the woman, blood all over the place, toilet, floor, everywhere. Her husband on the ground. I asked my nurse, I said, "What's going on?" And she said, "Get the delivery kit." So at which point I radioed overhead to clear one of our trauma bays, get the delivery kit, and in the toilet was a 22-week preemie fetus, umbilical cord still attached. We're able to cut the cord. We brought the mother to trauma bay 1. The child we brought to the trauma bay next door. At the time, there was a heartbeat. The fetus was moving slightly, ashen gray. We call for a 123, which is a crash C-section for the labor and delivery, but in the ER, it's a pediatric delivery emergency. Basically, we're requesting all the neonatal supplies to come down to the ER immediately. We attempt to intubate this fetus. Fetus was 22 weeks gestation, which is non-viable. Unfortunately, if this fetus was 4 weeks older, 26, measures could be taken to perhaps, save this child. Unfortunately, at 22 weeks, it's a non-viable child, and efforts were terminated right then and there once we found out the gestational period. Everybody comes down, they recognize the mother, and they know her because she was actually at the hospital 3 days prior with abdominal pain, and she was discharged home for follow-up. Unfortunately, today, the one key aspect we missed was she had abdominal pain with bleeding. Definitely traumatizing because you never want to stop. I had this thing in my hands, it was moving, it was alive. Unfortunately, though, it cannot sustain life outside the womb. Patient comes in on a stretcher by ambulance. Chief complaint of overdosing on PCP. PCP is a very common drug used in the New Haven area. PCP, unfortunately, has a tendency to make people unpredictable. This patient comes in mouthing off to EMS. By protocol, security meets him at the door. They bring him down. We do a safety check on them. Metal detector, check for any weapons, check for any paraphernalia as well. This patient, in the middle of this, jumped off of the stretcher and tackled our security guard. And they started fighting in the hallway. At one point, the patient had the security guard up off his feet in the air and was swinging him. At this moment, I jumped up, tackled the security guard and the patient, grabbing the patient around by the waist, lunging them into the hospital stretcher, and we actually took out ambulance door or the doors to room number 4, crashing into that room. At that point, it was the 3 of us scuffling on the ground, trying to, again, restrain the patient for the safety of ourselves and himself. Orders were promptly placed by the hospital staff to have this patient restrained and chemically medicated with Haldol and Ativan, which we call 5 and a 2, 5 milligrams of Haldol and 2 milligrams of Ativan IM injection. Afterwards, about 3 hours later, patient was off his high and the Ativan and Haldol was wearing off. He was remorseful and apologetic with no recollection of the event occurring. Shook my hand, and unfortunately, it's the cycle we see down there.